callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to your Hometown Health Show, brought to you by Trilogy Home Healthcare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
Certain times, I think that we're definitely seeing a shift in healthcare right now. And a lot of patients and families and consumers are definitely we're seeing a decrease in patients and families wanting to allow people into their homes for good reason. Due to the fear, which is completely understandable, we are approaching the unknown. And because of this, agencies and companies like Trilogy Home Health and we have our guest here, Nestor Rodriguez from Florida Internal Medicine Associates. Companies like themselves, are having to take extreme measures and different measures to not only keep their staff safe, but also the patients safe. And, we're doing everything in our power as possible to keep our staff safe and just have comfort in knowing that we are here to help support you as well. And so I do want to welcome Nestor Rodriguez. He is the office manager at Florida Internal Medicine Associates. So welcome.
No, thank you. Thank you for having me. This is a pleasure. It'll be my first time, but this is a pleasure being with you.
Absolutely. So Nestor, why don't you tell us a little bit about yourself and your role at Florida Internal Medicine Associates?
Well, we started, the biggest thing was getting to the home, getting to these patients that couldn't make it to the doctor's office. Of course, we didn't have what was going on right now, but this started about 10 years ago because we wanted to bring the medicine to the patient. It was always patient having to come to the office, spend almost an hour, 2 hours in the office. And it was like a total of 4 hours just to go to a doctor's appointment. So we changed that mindset to start going to the homes. So we service both Broward and Palm Beach, but that was the idea. The idea was to bring the care to them. With that, it started growing into companies like you, like Trilogy, that we were able to help better the patient, get x-rays done at home, do lab work at home. That was the biggest thing. So, and it grew a lot. Practically, we have grown by word of mouth. Well, we don't do much advertising, but we like people referring us for the care that we provide for the patient instead of just advertising out there, just for patients referring one by one to us. And that's how we've been growing for the last 9 years.
Wow, that's fantastic. And tell us a little bit about the staff that you have on board over there.
We have Dr. Nemhard. He's their medical director. Below him, that work with him is 5 nurse practitioners. So we cover both Broward and Palm Beach. So it's a big area. We divided between them, especially for homes. We visit also skilled nursing homes, assisted living facilities, independent facilities, and the home visits. With that, we try to differentiate which covers what area covers better. The staff that we have here in the office, we have 2 medical assistants and we have 2 coordinators and myself. And that's how we're able to coordinate the visits with the home health or with whoever calls for an appointment, whether they need it in the office or they need it at home or they're needed in an assisted living facility.
Okay. And can you tell our listeners what type of insurances you take, whether it's, in assisted living versus nursing home or versus a home setting?
Perfect. Very simple though. Medicare, I love Medicare. What is just straight Medicare? We're able to do more things for the patient that all these managed cares. It doesn't mean managed cares are bad. It's just the way that they care for it. You care more. It's easier to care for a patient when they're under Medicare. That being said, we do take Blue Cross Blue Shield. We take United Healthcare or AARP Medicare Complete. A lot of patients in Palm Beach have AARP Medicare Complete. We take Cigna. We take the Aetnas, Coventry, and we do take some managed cares, which are the Humana and AFMED. but those need to be changed first to for the primary physician before we could actually service those patients. But we like to have the best option is Medicare for the patient and be able to coordinate all the services that Medicare provides for the patient at home.
Okay. Okay. So it works a little bit differently if the patient is at home versus in a facility. That's what you're
Yes,
saying?
yes, and managed care.
Yeah.
Yes, and as an assisted facility, we could actually do the Uniteds and the Blue Cross Blue Shields and the Humanas. We still service them a little bit differently. There's more coordination. There's more referrals that we need to provide. Some insurance allows us to choose what home health they use or what companies they use. Others they don't. They just have to. They pick it for us, and then we just roll with what they tell us to do. That's the managed cares. United and Blue Cross Blue Shield are pretty open. They're pretty accessible, but it comes down to the insurance. The insurance is the one that provides where the patient has to have the care and what kind of care that they can receive at the place of living.
That makes sense. Okay.
Mm-hmm.
So I understand that Florida Internal Medicine Associates has like a network of providers. Can you tell me a little bit more about how that works?
Well, with bringing the care at home, we needed to connect with every company possible. We needed to find out how to do an X-ray, a basic X-ray, a chest X-ray, or if they fail, if they needed just a hip X-ray or an knee X-ray. Lab work, we get to order a lot of lab work, especially when you're in the geriatric population. You need a lot of blood work just to keep your values in check. You don't want to go overboard on something, and then you have to send the patient to the hospital. We try to avoid the hospitalizations. So we connected with that. I've tried to connect with diagnostic centers, LabWorks, home health, Lincare. Lincare provides the respiratory equipment. A lot of companies, and they all service Broward and Palm Beach, so we could service that for the patient, and the patient doesn't have to go out to look for those services. We even have some pharmacists that do delivery at home, so the patient doesn't have to go out and get the medication themselves, or have a POA or a caregiver go get the medication for them. They could actually have it delivered at home.
That's fantastic. Definitely. Now having this global pandemic, it's obviously very uncertain waters and uncharted waters that we're all facing, right? Having all of these providers, like I kind of talked about in the beginning, what measures are you all taking over at Florida Internal Medicine Associates to kind of combat that?
Yes,
Since
this has been since it started. Yeah, it's been a change totally. I mean, although we done home visits and your technology has really helped us a lot, we were not prepared for this. And then what we did in the month of March, we wanted to create a safe environment for the patients, especially our patients that are 65 and older, but also for our physicians, because our physicians are visiting the homes, but as they're visiting the homes, they also visit in nursing homes. They're visiting assisted living facilities. And that's how the virus could be spread. If just one person, even if they don't know that they're sick, they're going place to place to place to place. We need to have the proper precautions. That being said, thanks to CMS, to Medicare, they brought telehealth. So a lot of services that we could do now with that we used to do in the office, or we used to do face-to-face encounters at home, we could do it under telehealth. And thanks to the guidelines that have changed, well, and all these safety precautions that they're bringing, they allow us to do a lot of services without having to be present with the patient. Yes, a lot of patients don't like it though. This is new to them. And we want to enforce it that is for their safety. This is not because we don't want to get out of the house or out of the office to go see them. Is we want to make sure that we're both protected, and in the event that they do need it, then we could go actually assess the patient at home. That doesn't mean we cannot see them at home. It's just this is a safety net to make sure that everybody's taken care of without the need to go to their house.
Right. And we also have to understand that this generation is used to going to see their physician and used to, being in front of their physician, having their physician sit in front of them and talk about all of their issues and having an actual physical examination. But this is totally uncharted waters, I think, for everybody. And just having that conversation with them up front and knowing that it's not only for the physician's safety, but it's also for their safety. And it's it's just completely unknown for everyone. And I appreciate that the Center for Medicare and Medicaid is being more flexible at this moment to
Yes.
try and take that all into consideration for everybody. So that's helpful for sure.
That's very helpful. No, it's actually helping a lot of people. And then we're also taking the time. I'm trying to even on our website having information about videos, how telehealth works, what can telehealth do for you. Sometimes
Mhm.
you need a prescription, but you haven't seen a physician in 3, 4 months because there was no need. Then you don't need to risk yourself to go to a doctor's office or make an appointment because you just need that prescription refill. You just need that extra equipment order because not everything has to be renewed. And yeah, like everything, we try to plan, but we don't plan for this kind of stuff. We don't plan 3, 4 months ahead. We just plan for what we need the next 2 months, and then
Correct.
that's what is helpful for. And just having the option to do that, and that's what I tell my providers is that just having the option now you give the patient another option to care for that patient.
Yep, absolutely. And it's also helpful for the home health side as patients or consumers may need something. Let's say they fall at home and they're needing some physical therapy. Well, Medicare regulates that you have to have seen your physician within a certain time frame. And now they can have a telehealth visit and they don't have to risk, their own health to go out in the community, out into a physician's office where other people are really sick when they just need maybe some physical therapy, a physical therapy order where they can actually just have a telehealth visit with their physician and it qualifies through the Medicare guidelines for a face-to-face visit, which is very helpful.
And the great thing with Medicare, everything follows. Blue Cross Blue Shield follows the same way. Cigna follows. United Healthcare follows.
Yep.
So as long as Medicare puts the guidelines in there, all the insurances start following, and then it's a generalized thing for everybody. So it actually makes it easier for everybody. It's not just our elderly patients, which are the biggest
Right.
population that we care for, but it helps everybody. It doesn't have to be just to the elderly that we need to focus on.
Absolutely. Absolutely. Um, so what advice can you or your office give our listeners to stay safe out there during this global pandemic? I know that they've probably heard a million different things.
A
They're
million
hearing
things,
things,
yes.
looking up on their own on the internet. But, maybe what are you telling your patients as your practitioners are going out there? What are you telling your patients as your practitioners are going out there to stay safe?
Well, now, but it's changed every day. So what I'll tell you today might change next week. But the biggest thing is that precaution. Yeah, wash your hands. There's a lot of people that we're not used to washing our hands that often. Think about like you were touching your hands or playing with dirt, and then you went and touch everything in your house. You get everything
Mhm.
dirty, and you don't notice even when you're touching stuff, when you're touching surfaces or doorknobs, and then that alone, if you go outside, if you're touching surfaces that haven't been wiped or cleaned, then that's just be precautions. That doesn't mean just don't do anything at all. If you're gonna wear
Right.
gloves, wear gloves. If you're gonna wear a mask, wear a mask. But don't touch the mask with your gloves. Don't be driving with gloves on and then go around everywhere and come back into your car and drive with the same gloves that you're driving with. Then you're just it's easier not to wear gloves. So
Right.
keep it separate, and then if you're gonna wear a mask, but don't touch it. Don't touch it. I saw a lot of people. I went to Walmart the other day, and then as they're coming out, because it gets hot, they're not used to having something on their face. They were adjusting their mask with their gloves. They just spend the whole time inside the supermarket. So they shouldn't do that. Keep it away. Once you wash your hands, then you move your mask. Those are the precautions. And immunity. If you boost your immune system, vitamin C, B12, B12 shots, those are things that could actually, it won't prevent the disease or it won't prevent the virus, but it will keep you in better health. So if in case you catch it, you actually better to fight it. Your body will fight it better than just those things. And use everything that you have, your resources. This is a great country that brings all these resources, but you gotta look for them. And if you have an elderly parent at home or somebody, then use people like Trilogy use us to, we care for them and we coordinate that care for them. Don't think they're just left alone. There's places also delivering groceries. There's places helping with medications. There's ways that they don't have to go outside to risk themselves, that they could get it. So it's just giving us a call or calling Trilogy and finding more answers. That's even better for everybody.
Yes, absolutely. I think utilizing the whole network, which is what we do, is
Exactly.
fantastic. I like those ideas. I see people, like you said, wearing their gloves and doing everything that they were doing before, even without gloves. You're better just to not wear gloves and not waste them. Just wash your hands more frequently.
Exactly.
So I see the exact same thing, and then I see them discard them on the ground. So it's really foolish.
Yes, then that's the ways. Yes.
Um, what are your thoughts or any suggestions when it comes to social distancing with any of your patients? You know, I've even had some discussions within our own family about, you know, should loved ones go visit other loved ones, or should you just stay in your own home with your own, you know, immediate family? Have you had any patients or families ask you
We
that
have
type of
had,
question?
yeah, we have patients that, let's say they work in Tampa, Orlando, and they have family members here. And it's like, oh, my daughter works as a nurse up there. Can she come? She always comes on the weekends home. I would tell those to, like, even my mother. My mom I haven't seen. She lives 20 minutes from my house. I haven't seen her in the
Mhm.
last 30 days. That doesn't mean that that I haven't talked to her. You could talk to through video and stuff like that, but just the prevention. I don't know when I'm exposed. I'm not seeing patients every day, but if I'm exposed to somebody and then I bring it to my mom's house, then she's been quarantined for the last 3 weeks. She hasn't seen anybody outside their house, just for prevention. Then use those common sense. Don't like, okay, I'm going out a lot. I'm going out every day because I need to, because I have to work. Then don't bring it back home. When you get home, take everything off. Take your shoes off. Leave them on the side. Take all your clothes. Take a shower before you start moving around your house. It's just little things that we're not used to doing, but those little things add up. And then disinfect. If you don't have Clorox because you don't have Clorox wipes at home, or you don't have a Lysol, because I don't think you can find Lysols easily now,
Yeah, it's
just make
a commodity right now.
just use a solution. Use like 10% Clorox with water, and then that actually helps a lot to disinfect places. And just keep everything organized and neat, and then that we'll make it all together by eventually. It's a prevention every day. Always have it in mind. I don't. That's another thing. Going back to the mask and the gloves. Don't don't think because you have a gloves and mask you're protected. Then
Right.
you just go out there and do whatever. It's like, oh, I'm going to my mom's house, but I'm gonna wear a mask. That you don't know that we still don't understand how this virus works, how this actually mutates, how it's actually transferred. So until we understand that, there's just prevention and prevention that we have to continue. But don't be afraid either. I mean, if you can, it's like I was reading something that even children are being afraid of your own parents because they're outside and then they come in and it's like, oh, you brought the disease, and then you have a cough. Remember, we're still in the season where it's allergy season and also cold
Yeah.
season. With all this prevention, less people have gotten sick with the cold. They don't have cold symptoms, but now people are even afraid of coughing because, oh, you have it. So you have to have
Yes.
measures. The moment that you feel it, don't wait, don't hesitate. Call your provider, call us. Make sure that you see a provider. Make sure that your things are allergies and not the virus. And then we had a patient here 3 weeks ago, and then they had a lot of symptoms. The first thing that comes up to mind, oh, he has the virus. Well, eventually he got tested. He didn't have anything. He had just cold symptoms. There's a lot of
Yeah.
smokers, and most of them have cough and stuff like that. So prevention is just be careful. Don't overreact, but ask questions, and that actually will help you protect yourself and protect others.
Yeah. I completely understand that. I have asthma, and it's a bit uncontrolled right now. So anytime I cough, everybody stares at me. So I'm sucking on a cough drop right now, so I don't have a coughing fit. So I completely understand, and it does not mix with allergy season right now. So it's
Exactly.
a bit challenging. So being that you're obviously a healthcare provider, I'm in healthcare, even my husband's in law enforcement. Can you tell me what your suggestions might be for someone who is could possibly be working with a COVID positive patient and then having to come home to, their family. What precautions or extra precautions should they be taking just to keep themselves and their loved ones safe?
And that's when it comes separation. I mean, you don't have to quarantine. I read a lot of cases that even patients with the virus being positive and their wife and kids have not gotten it while being at home altogether. So yes, I mean, they say the first 5 days of the virus, you could have no symptoms at all and be the most transfer of the disease, that you be more um, you could catch it easier without having no
Right.
symptoms. So if you're like, for myself, if I'm outside, when I come home, if I was in contact with another patient that was actually positive COVID, then I'll try to quarantine myself, in the sense that I won't be near to them, or I won't kiss them or hug them or touch their face until all things normalize, because I'm trying to prevent them. I don't want them to get sick if I'm trying to stay safe, like especially your kids and stuff like that. So even my daughter, I don't kiss her anymore in the face, or say, or touch her hair. It's like, hey baby, how you been? You just keep distance, because we're trying to do that distancing, the prevention.
Right.
And as soon as you get home, wash your hands. If you need to take a shower, especially for us that work in the medical field, take a shower as soon as you get home. They have all these things online, but you really, soap and water takes it off. So if you
Right.
really shower, then you should be off. Put your clothing into the laundry, and then have a normal life.
That sounds like a good idea. I know I've been doing that with my kids. My husband, as soon as he comes home, I tell him, "Go shower, please," and then we can, do everything, because he's in law
Exactly. Be
enforcement.
family.
Exactly, and you just want to play it safe. Even the kids know, when we come home, nope, we can't do anything until they hold it. They get really excited because they're
That's
only
how my daughter
5
is. Yes.
so they're really excited to give us a hug and a kiss, but they understand, and it's a little unsettling for them because they don't really understand what's going on. They've seen us with masks. My mom has made them cloth masks. Actually, this weekend I spent some time. I've made some. I'll show you some disposable masks,
Oh,
surgical masks. I've been making those. We're going to be giving. We've been
beautiful.
giving them out to our office staff and giving them out to other professionals just as an extra precaution. But they've been wearing them anytime they've had to go outside, but they go stir crazy inside all the time. So it's quite an ordeal the entire world is dealing with right now. So
It's a different of caring for people, yeah, very different. But actually, because our providers understand the medical, they actually know that they have to do those preventions. So don't question somebody when they have a mask or they have a gown. Oh, because I'm infected or something like that. They're just doing it for prevention for the patient and for everybody else. And I think for law enforcement also, is like I mean, I know they wear gloves, but they were not wearing masks before. So they need to start wearing masks, and especially when you're exposed to so many people. I mean, they can't stop being police officers, so the firefighter can't stop taking care of the patients. The paramedics cannot go. It's like, okay, I'm not going there. No, they have to. That's the whole part of the thing. Hospital workers too. So if you have to continue working, just do the preventions and quarantine yourselves from your loved ones. Especially for myself, if you have an elderly patient, a family member, try to do everything through the way we have it, like deliveries, supermarket deliveries, and don't visit them, and tell them it's not because I don't want to. It's just I want to prevent you from getting sick.
yes, and I know some of the deliveries sometimes can be challenging through the grocery stores, but there's also private duty companies that can offer
That will help
that and
out.
actually
Yes.
type of service for you. So I know I work with a few of those agencies and companies that do that, which is very, very helpful. And they can just drop it right at your front door and leave. So that's
Well,
extremely
and that's the
helpful.
easiest part. They just call Trilogy, and then you get them the answer. Much easier in one place than having to know all the places that you go to.
Absolutely. Um, One of the last things I want to ask, Nestor, I know your name and phone number has been up there, but how can consumers and potential patients and families get a hold of Florida Internal Medicine Associates?
Well, you're always welcome to call our phone, and the phone number is 954-725 7291. That's our office phone. It works 24/7. Although we only answer the phones from 9 to 5. It's actually 24/7. We have the nurse practitioners. We always have a nurse practitioner on call, so you're able to reach him. And the worst case scenario, if you're a new patient to us, we always ask you to first call our office so we could set you up as a new patient, and then from then on, you could always call even weekends. There's a lot of people don't like calling, so we have also the online options. You could visit our website. It's FloridaInternalMedicineAssociate.com without the S at the end. Or you could go on our Facebook page. It's at FIMA, FIMA 1899. And you could get all our information. There's also, we use a website called SockDoc here in Deerfield Beach to schedule online appointments. So you could actually go in there as well and schedule online appointments if you're trying to become a new patient. You could do that at night, you could do that in the weekends, you could do that at 5 in the morning. It doesn't matter because it's online. And then once we come here to the office, we'll give you a call if you need help, or we'll coordinate everything. Especially now with the telehealth, we're trying to make sure that people have access to us and able to reach us faster. That way you could actually be seen by a doctor.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com.